at my birth plan. I'm supposed to send it into the hospital this week, and I'm a first-time mom. I don't know if I have everything right, if this is things that they need, if it's too much. Like, I literally need help.
Say less. I'm a birth doula, and I will absolutely go over your birth plan with you.
Starting with the environment. Do you really need to say that? I'm just like a calm, like low light room. I don't really want music on. I feel like I'm gonna get irritated by music. I like comfort shows, so I think I'm gonna go with like Disney movies and stuff. I don't want any kids in there, not kids, you know what I mean, students or anything. A lot of people put on there like they want a low voice. I want it to be normal. I don't really want it to be like, oh gosh, she's giving birth. I don't want that. I don't like to be touched, so I put in there that I don't want to be touched during contractions. I don't know if I'm gonna change my mind. Like, did you like to be touched? I don't know. I'm not a touchy person. I feel like it's gonna stress me out. I also would like to like move as much as possible, which does that mean I cannot have an IV? So I really don't want an IV because I'm scared of needles.
So all of that does sound really good and definitely reasonable. One thing I will say is to have a longer discussion with your provider about an IV, because that is one thing that a lot of providers will have pushback on because it is really important what they can actually do. So a lot of people don't actually know this, but it's not a needle that stays in your vein. They essentially place a needle just to place a thin little tubing, and that tubing is what stays in your hand. And they can do what they call a hep lock. So essentially they place it and then they can cap it. So it is not hooked up to anything. You are able to freely move around, but it is there in case they need it. So that is something that I would discuss with your provider in more extensive discussions. I'm not saying that you can't refuse it, but there are benefits to even just having a hep lock. Everything else looks great. You can absolutely have a calming environment. You can absolutely ask to be not be touched. That is totally reasonable.
I plan to not have an epidural because I actually can't have an epidural because I have 2 rods and 21 screws in my back, so they won't be allowing me to have that anyway. I decided to just put it on there just in case like they forgot.
Make it be known that it's not just that you don't want an epidural, it's that you can't have an epidural. And make it very clear, because a lot of times if you were like struggling through labor, they will go, are you sure you don't want that epidural? Make sure that they know that you cannot have an epidural.
I don't know if they have the nitrous oxide laughing gas. If they do, I feel like I'll feel so much better because you can have the epidural. I would like to be in the shower as much as possible. Like, if I have to give birth in the shower, I feel like I'd be happy with that. I know they probably won't like let that happen. Limited cervical checks and exams. Put that on there because I still don't want someone else's. Do they really come in there and do it that often that you have to say like, I don't want so many? I do want my water to break naturally. I do not want that balloon thing. I had to look that up. That's terrifying. Did anyone else have that? Because I don't think I could handle it. Gosh. I want to avoid Pitocin if possible, but also if it needs to happen, it can happen.
Before you go into labor, it is absolutely okay to ask, call up your hospital and like ask if they have nitrous oxide. That way you can better plan for your birth and like pain relief wise. Limited cervical checks. So this is a different thing for every single person. Some people it's like, I don't want any checks at all. Some people it's like, okay, I'll have like one every 4 hours or so. So just be more specific on there. Having your water break, perfectly fine. So the balloon. I feel like a lot of people don't know this. The balloon is an induction technique. It is only used when you are going in for an induction. That is when it is used. So if you go into spontaneous labor, it's not even going to be offered to you. But if you do end up having to be induced, a cervical balloon is not as scary as a lot of people say that it is, and it can actually mean the difference between being on Pitocin for 12 to 24 hours or being on Pitocin for like 6 to 12 hours. And avoiding Pitocin, that is great. And also really great that you added unless medically necessary. That lets your providers know that there is a point where Pitocin may be in your cards.
I'm about to take a birthing class. I don't even know what pushing is going to be like, but people said that they want to just push when it feels right to them. I'm going to do like natural pushing positions, and I don't bend, so I don't want to lay on my back. I feel like that'd be uncomfortable. Squatting or something, I don't know. I'm started like looking up like how people give birth. I know I don't want the vacuum or like the little things. I want to cut the cord. I feel like that'd be really cool. Delayed cord clamping, immediate skin to skin, no nursery time. I'm going to take my placenta home. I don't know why I want to take it home, but I want to take it home. Am I going to do with it? I don't know yet, but it's mine.
You can absolutely push in any position that you want to, especially since you are going unmedicated. A lot of times your body will be screaming at you to get into one position or the other. Forceps and vacuums are no longer routine and should not be used unless medically necessary, unless your baby is stuck. So delayed cord clamping is a routine thing that they do now, but it is 30 to 60 seconds. So I would definitely still keep the waiting until it is white and flat on there. That way they know to not cut it at that 30 to 60 second mark. Also at the point of delivery, I would have them reiterate that you don't want it cut immediately either. You can absolutely cut the cord. You can do immediate skin to skin. Baby staying with you, that is also more something that they are leaning towards in 2025. A lot of hospitals don't even have nurseries anymore, and you can absolutely take your placenta home.
All of the procedures in the room, he is going to be circumcised, so I don't know like how that's going to work. If possible, I would like my mom or my husband to go with him because I don't want my baby by himself. Okay, I'm gonna see if they'll let him like delay all of like the measurements and everything like that to do skin on skin. I also saw to like breastfeed immediately. I don't know about that. Like, is that a thing? Can I do that? Will they even be ready? I don't want to do the bath there. I don't know about the leaving the vernix on. That seems kind of gross. But, like, can I still just wipe him down? I'll give him a bath at home. A lot of benefits to it. And I did a lot of research, but it's kind of gross, right? Gonna do the vitamin K shot because of, you know, the circumcision part. I'm gonna decline the eye ointment. I don't have anything. I've been tested. Nothing's happening. So I need the other stuff too. I don't even want to get into that. So like, if you're gonna comment mean stuff, just keep it to yourself.
All the testing can be done in the room. I will say with circumcision that they do have to take that out because it is a sterile procedure. Intermittent monitoring for you during labor, it really depends on your risk factors, but majority of the time it can be done. Everyone should absolutely be delaying like the weights, everything until you get that bonding, until you get that golden hour. That should be delayed at least 1 to 2 hours. You can absolutely request to have no bath or leave the vernix on or not leave the vernix on, but I will say that once baby comes out, if you don't specify that you want to keep the vernix on, they will absolutely wipe it off. It does have many benefits though. You can accept or decline any singular kind of thing like the vitamin K, oral drops, anything like that for your baby too. So you can immediately breastfeed. It is recommended to breastfeed within the first hour after delivery.
A C-section. I'm gonna try to be awake. I want my mom or my husband there. My husband's like a little iffy about it because they gotta like cut me open. I get it. I'm not even worried about it. I do want to do immediate skin to skin. I still want cord to be delayed. I guess I can't cut it if I have a C-section, right? If I can't cut it, I'll be kind of mad.
Okay. In case of C-section, I want you to have a longer discussion with your provider before labor even starts, before anything like that starts. I want you to have a prenatal visit with your provider and talk to them about in case of a C-section, because I know that you said that you cannot get an epidural because of your back, and if you cannot get an epidural, that might mean that you cannot get a spinal as well. You might be able to have a consult with an anesthesiologist to see if you are a good candidate for either. But if you cannot get a spinal, a lot of this might go out the window, and I don't want you to be disappointed. I want you to be prepared. So if you're not able to get a spinal, they will have to put you to sleep under general anesthesia, and in that case you will not get your mom in the room. You will not have delayed cord clamping or skin to skin, any of those things, and I really want you to talk to your provider about that. All in all, this birth plan looks really great. If you guys want me to react to any other birth plans, let me know in the comments.